Imagine a crucial conversation that every man over the age of 60 should have, yet one that rarely takes place within the walls of a doctor's office. A dialogue about 3 simple daily practices that can shield the health of your prostate. Habits that, according to science, can be even more effective than expensive medications, but are surprisingly overlooked by the vast majority of men at this stage of life. My name is Lara Mazini. I am a urologist with more than 20 years of experience, and today I'm going to share with you scientific discoveries that have the power to transform your well-being in a lasting way. If you are over 60 or have a loved one in that age group, it is essential that you stay with me until the very end of this video. What I am about to reveal is not based solely on my clinical practice, but on groundbreaking research that is reshaping the way we understand prostate health in later life. And I promise you, at least one of these practices will genuinely surprise you. Before uncovering these 3 powerful secrets, you first need to understand why the prostate requires special attention after 60. Think of it as a small walnut, a silent guardian strategically located just below the bladder, encircling the urethra like a ring. Its primary mission is to contribute to the seminal fluid. However, as men age, especially after the age of 50, hormonal fluctuations cause it to grow. This enlargement, known as benign prostatic hyperplasia, is a reality for almost all men, though in different degrees. By age 60, this condition is already present in about 60% of men. By 70, that number rises to 70%. And here lies the blind spot that many professionals fail to emphasize. As it expands, the prostate squeezes the urethra, leading to symptoms that may feel all too familiar. Difficulty starting urination, a weaker stream, the uncomfortable sensation that the bladder never fully empties, and of course, frequent interruptions of sleep to go to the bathroom. And here's the part that might leave you astonished. Most men accept these symptoms as an unavoidable sentence of aging, when in fact there are natural methods, strongly backed by science, that can slow down and even reverse much of this discomfort. And that is precisely the path we are going to explore together today. The first habit I want to reveal may sound basic, but its impact is monumental. Strategic hydration. Perhaps you are thinking, "Doctor, everyone knows the importance of water." Allow me to explain why the way you hydrate can be the dividing line between a peaceful prostate and an inflamed one. Recent studies have shown that chronic dehydration, a very common condition among older adults, makes the urine more concentrated, which irritates both the bladder and the prostate. When water intake is insufficient, the body produces denser urine, packed with toxins and irritating elements. This has the potential to inflame the prostate and drastically worsen urinary symptoms. But here's the big secret that few people talk about. It's not only the amount of water that matters, but also the timing. Smart hydration means consuming most of your fluids during the day, with a focus on the morning and afternoon, and gradually reducing intake after 6 p.m. This way, you keep your prostate hydrated and healthy without having to wake up multiple times during the night to urinate. Research indicates that men who adopt this hydration pattern report up to a 40% reduction in nighttime prostate-related symptoms. It is a small adjustment with the power to revolutionize your sleep quality and, as a result, your overall quality of life. The second pillar of prostate health is a remedy in motion, something you most likely already have at your disposal: the post-meal walk. Research has shown that older men who dedicate just 15 minutes to walking after their main meals have a 35% lower risk of facing serious prostate complications. And what's the science behind this? When you walk after eating, you trigger a series of mechanisms that are highly beneficial for the prostate. First, walking enhances blood flow in the pelvic region, supplying the gland with more oxygen and nutrients. Second, it helps stabilize blood sugar levels, and let's remember, diabetes is a known enemy of prostate health. Additionally, the simple act of walking after meals functions as a natural anti-inflammatory for the body. Chronic inflammation is one of the main drivers behind irregular prostate growth and the formation of problematic cells. By incorporating a post-meal walk into your daily routine, you are literally fighting the inflammation that threatens your prostate. And the best part, it doesn't require any strenuous effort. Just 15 minutes of light walking after lunch and dinner are enough to reap these extraordinary benefits. It's a small investment of time with a massive return for your prostate health in the years to come. Now we arrive at the third and final habit, and I am aware that this one may cause a bit of embarrassment. Still, it is my responsibility to address this topic with the clarity and respect it deserves. I'm talking about maintaining an active sex life, which includes self-stimulation. I understand that for many men of your generation, this subject is surrounded by taboos and preconceived notions. However, as your physician, I must share what science has revealed. A landmark study conducted by Harvard University, which followed more than 30,000 men over 2 decades, reached a remarkable conclusion. Men who ejaculate regularly have up to a 33% lower risk of developing prostate cancer. We are not talking about anything extreme, but rather a frequency that many would consider regular, around 21 times per month. The scientific explanation for this is fascinating. Ejaculation acts as an internal cleansing mechanism for the prostate. Each time, old secretions, dead cells, and potential toxins are expelled from the gland, preventing the buildup of harmful substances. Furthermore, regular sexual activity, whether with a partner or through self-stimulation, improves circulation in the pelvic region, reduces stress, and helps relax the muscles around the prostate. All of these factors contribute to a healthier prostate that is less prone to complications. I fully understand that for many older men, especially those without a regular partner, masturbation may be seen as something inappropriate. But let me be clear. From a medical standpoint, it is a perfectly normal practice and highly beneficial for prostate health at any stage of life. If the topic makes you uncomfortable, I encourage you to have an open conversation with a trusted urologist. He will be able to guide you individually and address your questions without any judgment. Now, it's crucial to understand that these 3 habits are not magic pills that work in isolation. Their effectiveness is maximized when they are integrated into an overall healthy lifestyle. This includes a diet rich in antioxidants, such as lycopene found in tomatoes, regular physical activity that matches your age and capacity, and proper management of risk factors such as obesity, diabetes, and high blood pressure. I also want to emphasize that no natural practice replaces the importance of regular medical checkups. Men over 60 should maintain their annual visits to the urologist, which include tests such as PSA and the digital rectal exam. Early detection of any change in the prostate is the foundation of successful treatment and of a long, fulfilling life. Remember, taking care of your prostate is taking care of your quality of life. These 3 simple practices may be what separates an active, independent maturity from a stage marked by limitations and discomfort that could have been prevented. Many of my patients experience significant improvements in urinary symptoms after adopting these habits. This is not just medical theory. It is practical, real-world results that I witness every day in my office. If this video brought you valuable information, I kindly ask you to show your support by leaving a like below. That simple gesture motivates us to keep creating high-quality content about men's health. Don't forget to subscribe to the channel and activate the notification bell so you'll be alerted about every new video focused on healthy aging. And in the comments, I'd love to hear from you. Which of these 3 habits do you already practice, or what specific question do you still have about this topic? I read all the comments and always make an effort to reply whenever possible. See you in the next video.